NUR 355 Exam 1 Newest 2026-2027 Actual Exam Preparation with Complete Questions and Correct Answers with Rationales. Question 1. NUR 355 Exam 1 Newest 2026-2027 Actual Exam Preparation with Complete Questions and Correct Answers with Rationales, already graded A+, brand. New version. The patient with NSUD diagnosis may demonstrate which symptoms? Select all that apply. Failure to fulfill major role obligations at work, home, or school. Recurrent use in situations in which it is physically hazardous. Continued use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of the substance. Withdrawal from the substance when the dose is decreased or stopped. Successful attempts to cut down. A, B, C, and D. Question 2. Rationale. The individual who has a SUD may not adhere to an expressed plan to cut back on the amount or frequency of substance use. The nurse recognizes which patients are at risk for developing problems with substance abuse. Select all that apply. The 14-year-old girl whose family has just moved and is smoking and drinking after school with friends. The 17-year-old senior in high school who has untreated ADHD and whose mother has an AUD. The 32-year-old mother of 2 with a past history of binge drinking in college whose husband just left her. The 52-year-old executive with severe back pain who typically drinks cocktails in the evenings after work. The 64-year-old recently retired man who has an occasional drink in the evening after work. A, B, C, and D. Question 3. Rationale. The 14-year-old girl who is drinking and smoking with friends after school is at risk because of her young age at initial use and the fact that this is a time of stress and transition for her with the recent family move, having to go to a new school and worry about fitting in, etc. The 17-year-old boy is at increased risk because males are almost twice as likely as females to have problems with substance abuse. Additionally, he has comorbid, untreated ADHD along with family history of alcoholism. The 32-year-old mother with a past history of problematic drinking in college is at increased risk of developing problems as she goes through the stress and transition of a divorce. Lastly, the 52-year-old executive is at increased risk because of his pain issues and his routine drinking in the evening. While a life change such as retirement is a risk factor, the man in choice has limited/less risk due to his limited prior drinking history, which reaction in the brain results from drugs causing overwhelming surges of dopamine, produce more of the neurotransmitter, increase the number of receptors that can receive and transmit signals, have increased ability to respond to any pleasure, have decreased ability to respond to pleasure. D. Rationale. Addictive drugs, directly or indirectly, target the brain's reward system by flooding the circuit with dopamine. As a person continues hazardous use of drugs or alcohol, the brain starts to adapt to these chemical changes by producing less dopamine, reducing the substance user's ability to enjoy drugs and the things that previously brought pleasure. Question 4. The nurse working in the pediatric clinic is performing substance abuse screenings on all children aged 12 to 18 as part of a community effort to identify at-risk teens. The nurse should consider which teen at greatest risk. The 13-year-old girl who has recently been irritable and moody. The 14-year-old boy being treated for diagnosed ADHD with prescription stimulants. The 15-year-old who recently entered high school and appears down, reports trouble sleeping, and has difficulty concentrating. The 17-year-old cheerleader who quits the squad, suddenly changes her group of friends, and has been acting very secretive. At home. Answer, D. D.